Namaste, I am Dr. Sonali Gautam. I am a consultant gastroenterologist and hepatologist at Airoli Center for Digestion. Today I am going to discuss about colonoscopy. So what is colonoscopy? Colonoscopy is a procedure where we examine the large intestine. We put the scope, the machine which has a camera through the anus into the larger intestine. First, why we do it? So colonoscopy we do in examining the patient for blood in stools or chronic diarrhea, whenever there is a history of diarrhea for more than 4 weeks, or if the patient has pain in the lower abdomen or has a significant weight loss. So we do a colonoscopy to rule out whether there is intestinal TB, whether there is intestinal infection, intestinal ulcers or intestinal cancer. So these has to be ruled out, and this can be easily done by a colonoscopy procedure. Now, colonoscopy procedure is a little lengthy procedure than gastroscopy. It is usually done under sedation because whenever we go inside, we put lot of air to inflate the colon. So when patient comes out from the procedure, patient usually complains of pain, but once the patient passes gas, he feels better. And sometimes when we go inside, we take some biopsies so that we can examine it further. From there can be some bleeding points which is easily controlled, or it spontaneously gets controlled. Very rarest complication seen in colonoscopy is perforation of the intestine, which is very rare, 1 in 10 lakh or 20 lakh person, but it is usually not seen in young patients. So these are the few known minor risks of colonoscopy. Now, how is the colonoscopy procedure done? So one day prior, we give you one solution to drink, after which the patient passes 10 to 15 motions because colon has to be cleaned, otherwise my camera will not see anything. And the next day, the patient needs at least 6 hours of fasting. We put the patient under sedation and put a scope, and it takes minimum 10 to maximum 15 to 20 minutes to examine the inner lining of the large intestine. It's a very safe procedure. The only thing the patient complains is once the sedation weans off, patient complains little bloating and pain which goes off in 1 to 2 hours. And it's a very safe procedure, and if your doctor is suggesting colonoscopy because of your symptoms, then please go ahead, and if you have any other further queries, kindly contact on the number given below. Thank you.